we're ready to begin.
All right.
Well, welcome everyone. Thanks for coming. This is the People's Priorities, understanding the policy areas that matter most to Massachusetts DD community. I want to thank you all for coming today. And go to the next slide. As you know, we're the Massachusetts Developmental Disabilities Council, and our mission is to empower individuals with intellectual and developmental disabilities and their families to lead successful lives in their communities by promoting self-sufficiency, community inclusion, and opportunity. And the way we do this is through policy change. Next slide. I'm Jossie Burke-Sabat. I'm the policy chair, and I'm going to have our policy team introduce themselves. Jennifer?
Hi, everybody. My name is Jennifer Bertrand, and I'm the Deputy Director here at the Massachusetts Developmental Disabilities Council. It's so wonderful to see you tonight. Thanks for being here.
Joshua?
Hi, everyone. My name is Josh Gladstone, and I'm the Disability Policy Specialist at the MDDC. And as Jennifer said, I'm very excited to be here and see all of you.
And Caitlin?
Hi, everyone. My name is Caitlin Stober. I'm a policy research associate with the MDDC, and I am going to walk us through our next couple slides. So I will take over from here.
Thank you, Caitlin.
Caitlin, I'm going to interrupt you for just 1 second. We have a special guest here today from Senator Robin Kennedy's office. I believe Brian Bates is here.
Welcome. Thank you so much for joining us. I hope that you and everyone else here can learn a little bit about what we learned from asking people what mattered to them most here in Massachusetts. So that's what this webinar is generally going to cover. We're going to be talking about our legislative priorities survey. The Massachusetts Developmental Disabilities Council is focused on our community here in Massachusetts. And we created a survey that asked people to share their opinions about what policy topic areas were most important to them in their lives. And we were so thankful that so many people shared with us. And we wanted to make sure that we shared that information back with you. All right, so to start off, get a little snapshot of who took our survey. We had 400 people take our survey. 371 of those folks took it in English and 19 took it in Spanish. 77% of our participants were white, 5% were Black, and 8% were Hispanic. 5% said that they were a different race than that. And then we had some smaller percentages for folks who were Asian or multiracial. 80% of our participants were female. This is actually fairly consistent with some of the other surveys we've seen in our space, but it is a high proportion. And we were really excited that of the 400 people that took our survey, 151 participants said they'd be interested in working with us to provide testimony on some future bills that impact the developmental disability community. At the end, we'll have a little thing about how we can stay connected. So just know if you didn't say you were interested in the survey, we still want to work with you and you can keep in touch with us so we can help you do that. So this map shows a geographic spread of kind of where we got some of these survey responses from. Now, I want to say that providing your zip code or where you lived was completely optional. So 287 people of the 400 who responded shared their zip code with us. So when we look at this map, the yellow regions are zip codes where we had someone respond to our survey, and the blue is where people didn't respond to our survey. Now, this is the minimum amount of yellow that we could see. We expect that actually more of this map would be yellow if everyone chose to share their zip code, but because it was optional, we don't have that information. Overall, though, we were really pleased to see that we tried to get a wider spread across Massachusetts, reach some folks in Western regions, reach some folks down on the Cape, and not just have everything coming from, the immediate Boston area. So this is kind of a snapshot of who we were able to reach, and hopefully we can continue reaching more regions. All right, again, who took our survey? Now, at the start of our survey, we asked people to let us know if they identified as having a developmental disability, if they were a family member, maybe a professional who worked in the developmental disability field, or if they fell into some kind of other category that made them want to take our survey. So overall, 17.5% or 70 respondents reported having a developmental disability. They're represented by the yellow icons of people on this kind of chart. And you'll notice some of the people have more than one color. So we've got some folks who have a little bit of yellow, a little bit of light blue, a little bit of yellow, a little bit of dark blue. And this is because many people had multiple identities. So some folks with developmental disabilities were also family members or were also professionals who worked in the field. Um, so we've got the yellow category, right? Folks who said they had a developmental disability. Then the light blue, which is kind of most of the people in this chart, 66.5% of folks who took our survey said they're a family member of someone with a disability. And then 35.25% reported being a professional who worked in the field. And you'll see there's overlap there too. So some people were both family members and professionals in the developmental disability field. We also had some people who said they didn't fall into any of these big three categories. They were kind of an other. And mostly we saw people who explained that they were maybe a guardian, or maybe they were just friends with someone, or just cared about this from some other way. So, almost 2% of our sample put themselves in a different category.
What's up? Oh.
So what did we ask about in our survey? We had a list of policy topics that we knew were important to people because we talk with our community, we work in our community, we saw some legislation and bills about these topic areas in the past. So we had a list of 13 topic areas that we were going to ask people questions about. So that included housing, affordable and accessible housing, guardianship and alternatives to guardianship, like supported decision making, healthcare, home and community-based services, diversity, equity, and fair treatment in services, family support, the direct care workforce, community participation and inclusion, self-direction, transportation, employment, safety and violence prevention, and education. So we asked people specifically about these topic areas. We also invited people to write in or tell us about other topics we didn't ask about that were also important to them. And we got some interesting feedback. Some people, wanted to tell us that dentistry and accessible dentistry was really important to them, or maybe some other therapies that were useful. So we're going to talk mostly about these topic areas. A very few people added other things, but we're always interested in learning about different things that are really important to you if they're not kind of covered in these big categories. So the way we tried to learn like what topics are most important, we did this in two ways. The first way that we asked people to kind of share what was important to them is we asked everyone to rate each of those topic areas that I just mentioned on a 5-point scale, from this is not at all important to me to this is very important to me. So this kind of image on this slide has 5 stars that shows how people could have rated each topic area. And then what we did is we came up with an average rating for each of these policy topic areas. This is like if you go to the movies and you hear a movie was rated, 7 out of 10 stars, or you go to a restaurant and it has a 4-star rating. What that is they're looking at everybody who responded or provided a rating. We add them up and then we get an average of what that rating is. So that's how we got this information. The next few slides, I'm going to show you like the list of how all these topic areas were rated, what was most important. But first, I'm going to have some slides that show you kind of how it's set up and what these things mean. So what I'm going to do is we're going to have some bars about the most important topic areas. This big white star is going to have the overall rating for each topic. It also has a ranking. So what was rated the highest, the second highest, the third highest. And so this big rating in the white star comes from everyone who completed our survey. Then on some of the topics, you're also going to see blue, yellow, and gray stars that are a little bit smaller. These are also going to have a number rating in them and kind of a ranking. And the blue stars represent how family members rated this topic. The yellow stars represented how just the people who reported having developmental disabilities rated this topic. And the gray stars represent how professionals who work in the DD field rated this topic. So what this does, it tells us overall in our sample how important people rated each thing, but it also lets us look at some differences, right? Are there differences or similarities in how people with DD think things are most important versus family members versus professionals, etc. All right. So when we dig into this, these were overall the top 3 topic areas with the highest ratings. We see home and community-based services was rated number 1 with 4.73 out of 5 stars on average. This is followed by healthcare and the direct care workforce. You'll see that this is not surprising, but that a lot of different categories of people also had these topic areas rated highly. That's why they were the highest rated overall. So both family members and professionals who took this survey also ranked home and community-based services highly. For families, it was the number 1 rated topic area. For professionals, it was the number 3 rated area. In terms of healthcare, persons with developmental disabilities rated this as their 2nd highest area, so kind of matching 2. This is the same as family members, and professionals rate it as the 4th most important topic area to them. For the direct care workforce, family members rated this as their 3rd most important topic. Professionals rated it as number 1. When we look at the theme that's tying these 3 topic areas together, what does this tell us? This tells us that Medicaid is really important to people, right? So there's some overlap between these categories and topic areas, and seeing that these 3 all emerged as kind of the most highly rated is telling us that people in Massachusetts really care about Medicaid. All right, let's see what the next ones are. So overall, the 4th highest rated topic area was affordable and accessible housing. This was actually the number 1 highest rated topic area for people with developmental disabilities. So they rated it higher than the rest of the respondents, which includes professionals and family members. Professionals rated this as their 2nd most important topic area, and family members rated this as their 5th most important topic area. After affordable and accessible housing, we have community recreation, inclusion, and social opportunities. This is number 5 overall. This is really driven by family members who rated this as the 4th most important topic area to them. One thing as we're going through this that I do want to note that some folks might already be thinking is because family members were the largest group of respondents to our surveys, usually they're most closely aligned with the overall rating, right? They had kind of the biggest influence on the overall score, which is another reason that we broke it up into these little stars too. So the 6th highest rated topic overall was family support. And for persons with developmental disabilities, this was actually their 4th highest rated topic area. So that's kind of interesting in terms of all the topic areas. People with developmental disabilities said, hey, family support's really important. It was in their top 5 priorities. It actually wasn't in family members' top 5 priorities. So that's something that's interesting and important to note. As our 7th highest topic rated topic area, we've got education. You'll see it doesn't have any little stars. This just means I only included little stars for the top 5 topic areas across each category. So after education, we had safety and violence prevention. And then in the 9th spot for overall rated topic areas was transportation. And transportation was actually in the top 3 highest rated policy areas for people with developmental disabilities. Now, because there's less people with developmental disabilities who responded to our survey, this didn't kind of correspond with the overall rating, right? So people with developmental disabilities are saying that transportation is really important to them, and they rated it as more important than family members or professionals in the field did. Mostly more than family members, though, because you can see that professionals in the field rated transportation in their top 5 topic areas. Does anyone have a question at this point in time? I thought I might have heard something. No?
I
All
do.
right. Yeah, Luigi, what question do you have?
When you say education, do you mean like education for like people with intellectual disability or autism or something?
That's a great question. So, for each of these topic areas, I didn't fully explain kind of what our description of them were. When you took the survey, there were different descriptions for each of these. When we're talking about education, we're thinking about anything from kindergarten through college, and specifically education as it relates to folks with developmental disabilities. So this does include people with intellectual disabilities as well. So we just asked education in general. You could be thinking about elementary school, you could be thinking about high school, you could be thinking about options to go to college. So that's what we meant when we said that category. Fran, I see that you have your hand raised.
Yes, I was just wondering, as far as transportation, are you talking about like transportation in like all part of the state, or are you talking about like certain areas? Because transportation is a big struggle, as you could imagine. No, I was just curious because it's transportation is just a blood topic, that's all.
Yeah, absolutely. So we saw that people with developmental disabilities rated this number 3. We weren't talking about transportation in a specific area of the state. That might depend on where somebody lives who responds to this survey, right? They might be thinking about the transportation opportunities where they live. But transportation, when we described it as a category, includes tons of things. It includes, you know, public transit. It
Access
includes
transportation.
having bus lines. It includes having, maybe having accessible vehicles, planes, trains, all forms of transportation. So this category did include that. And I do see in the chat, it probably does different. People have different priorities based on where they live. And if you live in some parts of the states, your transportation options might be better. So this is a big one. Even though it's rated 9th overall as a topic area, one thing I'll explain in our kind of summary is that we're still seeing all these topic areas are rated really highly. So people think they're really important. Just when it came down to it and we got the average ratings, there was an order. Yeah, so like I said, transportation included things like public transit. It would also include things, we see some legislation around ride shares and how people are able to access that or not, maybe depending on if they have service animals. So there's lots of definitely kind of tricky issues going on in the transportation space. Okay. Now, these are the last topic areas that we've got to cover in terms of the average rating.
Caitlin,
So,
before
yes.
you move on to employment, I just wanted to note a couple of messages in the chat. We had one
Okay.
person note that, in Cape Cod, transportation not rating higher could also be related to the location, which you mentioned that could be true. And it's a huge issue for people with disabilities who live on Cape Cod, especially in the more rural areas and out west. And then someone asked, would transportation count as an Uber or Lyft? And that would be yes.
Yes. Absolutely. And we know that that's a topic area that people care about too. Folks who respond to this, there's such a wide range of disability and developmental disabilities. For folks who have service animals, we've heard that the rideshare rules are really tricky, right? So that's an example of how transportation policy relating to rideshares like Uber or Lyft.
And the final message that we have on transportation, Fran noted that I know in Central Mass there's only one transit authority, but it doesn't cover whole Central Mass, and
Yeah,
I think it's
I
very
can see the
important that we
comment. So
have, okay.
So very important that we have transportation for all, not just some. Yes, I
Agreed.
agree with this. Outside of all policy areas, I'm super pro transportation. I really like trains and things like that. So this is definitely an important. Before I move on to kind of talking about these last topic areas, I see we have one more question in the chat about why was zip code optional for the survey? And this is because we respect people's privacy. So it was somebody's choice if they wanted to share this level of information with us. We wanted to know people, what the only thing required was for people to tell us about what topics were most important to them. Some people don't want to share personal information like zip code, maybe their gender or their race. So those items were all optional and people did not have to fill them out. One of the reasons we collected zip codes is because this is helpful for us when we look at representatives. So if we happen to know your zip code, you chose to share that with us, and we can see what topics were most important to you. We are really connected with our legislators and representatives in Massachusetts, so we can help you connect. So that's one of the reasons that we collected this. And whenever we work with folks, you're welcome to share where you live, but it's always your choice to do that. So that's why it was optional on our survey.
Caitlin, can I add as well that,
Mhm.
yeah, it was really helpful for those who felt comfortable sharing their zip code so that we can share the information. It's not connected to your identity or your name or your address,
Mhm.
but we can share with legislators in your district. Here's what people with developmental disabilities had to say about transportation or education or whatever the policy area is. And that can help inform them when they're making policy decisions.
Yeah, that's a great point. So that's something you might see as we do surveys and connect with the community as a council. We might ask you about that. If you have ever have any concerns about why you might not want to share that with us, you can talk to us. Again, you don't have to, but this is the ways that we use it. So we're not collecting it just to keep it and just to know it. We are trying to make sure that we're using this information so that we could be strategic about connecting people in the state who care about these things and making sure legislators know about it. Okay, I'm going to continue on and kind of review the last of our ratings for each topic area. So employment was rated, 4.38 out of 5 stars. This was 10th overall. Um, Self-direction was rated 11th with 4.24 out of 5 stars. But what I will say is that people with developmental disabilities put this in their top 5 rated topic areas. So self-direction was really interesting and important to people with developmental disabilities who took our survey. I think this is important to note. It's a little different than family members and professionals in the field who rated this a little bit lower. The proportion of people with intellectual and developmental disabilities who use self-direction to manage their service is fairly low. So, definitely interesting to see that emerge as a top priority actually for people with developmental disabilities. And then the next two topic areas we have are diversity, equity, and fair treatment, specifically in services. So thinking about how people's cultures can be respected and make sure that they're getting the things they need. And then the last one was guardianship and alternatives, like supported decision making. So even though this was not the highest rated of topics, it was still rated 4.21 out of 5 stars, which tells us that it is an important topic to people. It's just hard when you're looking at all these different ones and giving different ratings. Yeah, Fran, do you have a question?
No, I just want to give a compliment to people that actually recognize this because this is a very, very strong topic for me, and I always bring this to any committee or anything. So I just want to say thank you to whoever brought this up. Thank you.
Who rated it well? Thank you. And
Yeah.
Fran, which topic were you talking about? Self-direction?
Diversity and equity and treated fairness because I'm always bringing up at work about diversity, how it's important, and my job is known for diversity. So thank you for whoever brought it up. So thank you.
Okay, thank you, Fran. And we know that with our developmental disability community, we are a really diverse community. We've got people of all different races, sexes, sexual orientation, different needs. So diversity and equity and fair treatment, making sure people are respected when they're getting services, is an important topic, and people did rate it that way. Oops. Okay. So this was one way that we asked people what was most important to them, right? They went through every topic area and they gave it however many stars out of 5 to show how important it was to them. We also asked people to tell us what was important in a second way. And this was so we could kind of compare. The second way we asked people to tell us what was more important was by, out of this list of topic areas, we said, pick your top 3. So we were able to say, we know that you just rated many of these areas as very important to you, but if you had to pick your top 3, what would they be? So the next slide is going to show a chart of the overall sample that shows who put what in their top 3 priorities. Okay, so this is our bar chart. So some of the topic areas that we just learned about as being the highest rating are topic areas that people picked in their top 3, but we see some differences. So actually, the topic area that the most people picked as their top 3 priority area was affordable and accessible housing. So 41%, almost half of of folks who took the survey, put this in their top 3 priority. They said this one's really important. After that, we have 36.9, or about 37% of our sample, said the direct care workforce is in their top 3 priority. So the direct care workforce includes things like personal care assistants, home health aides, different ways that people are having support workers help them live in the community. Our third top picked priority or policy area for people saying this is in my top 3 was community recreation, participation, and inclusion. So 34.4%, or almost a third of our sample, or a little over a third of our sample, said that this was a top 3 priority for them. So being able to live and engage in their communities. Then after that, 32% of folks chose home and community-based services. So different services that you get from the state that help you live in your community. This includes things like direct care workers. And then we have healthcare. So about 30% of our sample said healthcare is a top 3 priority for me. So I'm seeing in the chat, Fran, you're saying, does DDS count? Yeah, so DDS might be a state agency that helps administer or manage the services that you get from the state. So that's definitely an example of an agency, if you work with DDS, who that might include some of your home and community-based services that you use. So if you've got DDS services you care about, then you care about home and community-based services probably. All right. So after healthcare, employment. So 28% of our sample said that employment was a top 3 priority for them. 23% said that family support was. 20% said that education was. 17.2% said that transportation was. I don't know if I just mixed up those words. So we've got education, then transportation. Self-direction, about 11% of our sample picked that as a top 3 priority for them. Safety and violence prevention, this is about 8.5% of our sample. 8.2% said guardianship and alternatives. And then 7.3% said diversity and equity and fair treatment were in their top 3 priorities. So when someone picked something for a top 3, like we learned, this doesn't mean they don't think the other areas are important. It was tricky for people to pick top 3. I know people were really struggling to make that choice, but we thought it was really important and a good way for us to understand, when we're thinking about different legislation affecting our state, how we can tell legislators how important things are to people. Does anyone have questions about this graph or how we learned what was important to people this way? Fran, do you have a question?
I think honestly, it's an important thing to show legislators and other how I say this, state workers to show like, yeah, this is the areas that we need to improve on, or this is where the struggle is, because every time um I feel this is what I feel, we go to our legislators, they just say, oh, we hear you, but do you really hear us when it comes to stuff? And showing
Mhm.
like statistics like this shows like, oh wow, 41% really needs help in this area. Let's work on how this part of this team works on this part, or trans-
Absolutely.
like so on and so on. Because
I'm
just
I'm
saying,
so glad that that's what you're getting from our presentation, Fran, because that's one of the things we're doing. We want to share this information with you so you can use it for your advocacy. We also want to share this information too because we want to work together as a team to improve the lives of people with developmental disabilities and their families. And we appreciate that you think this survey and information gathering is a useful way to do that. We definitely think so. So you kind of keyed me up for some of our end talking points. So we'll get back to that. I'm going to move forward for now and kind of sum up some of the things we learned.
yeah, it will help me when I meet with the governor's office.
That's awesome. And so, one thing, Fran, that we'll definitely talk about at the end too, where we'll open it up for discussion, is how we can help you as the Massachusetts Developmental Disabilities Council when you're doing these important advocacy works. And we are so happy to help you come up with talking points or use some of the information that we've collected. So I've got one question in the chat that I'm seeing. Do you have any idea how many people who take the survey, what percentage actually have, are able to use transportation options currently have or use sufficient community rec options, are employed? So that's a great question. We wanted people to take this survey, and sometimes when you make a survey super long, less people finish it and less people take it. So we chose for the purpose of this survey to make it just about priorities and what was important to you. However, one thing that we did is we also gave people the option, if they wanted, to share their contact information with us. So, things you can do are sign up for our listserv, share your contact information with us. So if we see you care about a topic, we can maybe reach out and see if you're interested in providing testimony, telling us more about this. So we don't have that kind of level of detail of like, why was this important to you? Is it because you are employed or you're not employed and you want to be? That could be information we maybe collect in a future survey, but it's definitely information we collect from people when we work one-on-one and we help individuals and groups kind of support their advocacy. So thank you, Deanna, for that question. I'm happy to talk more about that if you have more questions. I'm going to sum up our results now because one other thing we're going to do is look at some of how this affected some of the bills that are being proposed and things that we chose to be priorities for our council to spend time and resources on. So that's a little sneak peek. What we learned from this basically is like all these topics are important to people, right? They were all rated fairly highly. There were 5 topic areas, no matter which way you looked at it, based on rating or based on picking for your top 3 priorities that came out on top as important to folks. And this included home and community-based services, the direct care workforce, accessible and affordable housing, healthcare, and community recreation and social opportunities. So many of these topics overlap with each other, and we know that. So, as an example of things that overlap with each other, like we said, home and community-based services, the direct care workforce, and healthcare really fall under the Medicaid umbrella. So when we're thinking about policy areas and policy in Massachusetts, we're looking at that budget line item that's for Medicaid and home and community-based services and direct care workforce, because these things overlap with each other. And the fact that they've consistently risen to the top as things that are really important to people tells us that they deserve attention. We also learned that there were some differences in the priorities of people who had developmental disabilities themselves, were family members, and professionals in the field. So I wanted to call out 2 areas that, people with developmental disabilities rated transportation and self-direction in their top kind of the most highest rated priorities for them. And this was different than family members or professionals. Also, in some of those categories that might not have been the top rated, but were still important, included employment and then diversity, equity, and fair treatment and services. And in these two categories specifically, people with developmental disabilities rated it as much more important than family members or professionals. So this is important for us to know when we're trying to think about why are we prioritizing certain things? Who in the community is this helping? And this is just extra information for us to, make sure we're asking the right questions and focusing on the right things moving forward. So we collected this information because we care. We want the information about what's most important to you in your communities. And one of the first things we did with this information is we helped use it to inform our legislative priorities. So the Massachusetts Developmental Disabilities Council has endorsed and prioritized legislation. And these are bills that are being proposed to possibly become law. And we choose some of these bills that can impact people with developmental disabilities and their families. And that's how we spend our time and our resources. And we say, which ones we can't spend a lot of time on all of them, even if we want to. So which ones do we pick? So some of our top picks for these bills were related to the things you told us were most important in this survey. So these legislation lists, you might be interested. What did you pick as your priority or endorsed legislation? These are available on our website. And Josh Gladstone is here, and he is actually going to walk us through our website right now so we can learn about what some of these bills are and then we'll talk about how they connect to some of these priority areas. So Josh, I'm going to stop sharing my screen and I am going to pass it over to you.
Okay, perfect. Thank you, Caitlin. Hi, everyone. Just let's take a second for me to make sure I'm sharing my screen, and I will make sure everyone can see it. Is everyone able to see my screen?
I think it's still warming up. Oh, there it is.
Okay, great. All right, everyone. So this is our home base of our website. So the Massachusetts Developmental Disability Council, MDDC. To get to where we can find these lists, we are going to scroll down to close to the bottom of our page for what would you like to do, but we're going to click on disability policy. Once we get to disability policy, we are one more time going to scroll down to the bottom of the page to what would you like to do? And over here on the right, you can see our priority list and our endorsed bill legislation. So I'm going to click on that so that we can get to the bills. So here is our two lists, our MDDC priorities and our endorsed legislation. I'm going to take some time to try to, give you a top level description of what each of those bills are that we've selected that we're really going to allocate our time and our focus and our resources on making sure that those are the bills that, we're giving our best attention to. But of course, there's a lot of really important bills, and we as an agency are constantly looking at new things that are coming out and where we can be, trying to lend our support to other really important legislation. So this list is constantly evolving, but this is where we are right now. So before I dive in, just one other good thing to note is that as you can see here, that we have an H with a number and an S with a number. This means that when we have bills or legislation that are being put forward, they could be sent to the House or they could be sent to the Senate, these two different areas that make up our leadership in the state government. So often these bills will be sometimes the exact same language, or there will be a small distinction or a difference in how legislation is put forward in one of these groups. And we at the MDDC will kind of clump those together to make sure that we're giving our attention to things that overlap. So to start, we're going to go through our legislative priorities for 2025, 2026. And as Caitlin presented, we broke these up into some categories. So the first main category is housing, where there are two pieces of legislation. I'm going to be highlighting so that we know what we're talking about as we go. So this first piece of legislation is an act to create affordable homes for persons with disabilities. This bill will improve the Affordable Housing Voucher Program, AHVP, to help adults with disabilities have enough money to pay for rent for their homes. This legislation also ensures that the application process will be easier for gaining access to this program. Moving on to our next piece of legislation, we can see here an act expanding the availability of adaptable housing for people with disabilities and seniors. This legislation will work for bringing newly constructed buildings or renovated buildings under the guidance and the purview of the Massachusetts Architectural Access Board, or AAB. And this group really works to focus on developing and enforcing regulations and rules that make sure the buildings that we need are safe and accessible for people to use. I also want to take the time here to stress that this is definitely some high-level descriptions and that there's a lot of nitty-gritty pieces for what makes each piece of this legislation. So if there's anything that you have questions about, we at the end of our presentation will make sure that we again put up our emails and how you can get in touch with us so that we can work with you to have more conversations and figure out if these are pieces of legislation that you want to be talking about with your representatives. So moving on to our next major category here, we have family, where we have the Act to Prohibit Discrimination Against Adults with Disabilities and Family and Juvenile Court Proceedings. This bill requires courts to use clear written evidence, not assumptions, to determine if a parent's disability causes actual harm to a child. Moving on to our next big area, we have direct care workforce, where we have two pieces of legislation. The first is an act to meeting human service demand by modernizing incentives for the direct workforce. This requires salaries for direct care staff working in human services to meet or exceed the 75th percentile for comparable jobs. So this is really working at making sure that people are getting the money they need to do the jobs that are really important to our community. Next, we have an act relative to family members serving as caregivers. This legislation would allow MassHealth to pay family members for their caregiving services, which would help people with disabilities to remain in their chosen homes and live independently throughout the community, which we saw was one of those very important priorities that Caitlin had presented. Our next area is community inclusion and participation, another one of those top priorities, where we have this act, an act requiring universal changing stations in public buildings. This act requires at least one universal changing station to be installed and maintained in state-owned public buildings or places of public accommodation that have a toilet. This bill is important for making sure people can feel included throughout broader society and lets people use the bathroom with dignity when they are outside of their homes and their main space is their home base where they would regularly be. Next, we have education, where we identified this bill, an act relative to affirming and maintaining equal access to public education for all children. This legislation requires assessments and materials used to evaluate a student to be provided in that child's first and primary language that they best understand. This strives to make sure that we know what the child knows and that we can have accurate information about their learning progress because it will be in the language that they know best. Next, we have choice, an act to supported decision-making for certain adults. This bill would provide an alternative to guardianship by allowing adults, including individuals with disabilities, to maintain their right and independence by making decisions about their own life with a team of chosen supporters. Our next big category, which has three pieces of legislation, is healthcare. So first, we have an act relative to preventing discrimination against persons with disabilities in the provision of healthcare. The importance of this bill was really highlighted and emphasized during the COVID-19 pandemic, and this bill would work to prohibit doctors and medical providers from withholding or deprioritizing life-saving care due to a person's perceived quality of life because of their disability. Next, we have an act to enhance standards of care for those with autism and intellectual and developmental disabilities. This bill would create a state plan to develop training and education for healthcare providers and establish an appropriate standards of care for appropriately treating people with IDD. And then the last one under healthcare is an act to protect medically fragile children. This would ensure children and adults with complex medical needs receive continuous skilled nursing, or CSN, services authorized by MassHealth as medically necessary. And then we have two more pieces of legislation under our legislative priorities. We have here under services and support, an act strengthening transitional planning, increasing accountability for persons with disabilities and their families. And this legislation would improve reporting on people with disabilities approaching age 22 and create a commission to improve that planning and outcomes for their well-being. And then lastly, we have an act that expands wheelchair warranty protections for consumers with disabilities. This legislation aims to make the repair of wheelchairs more timely. So now if I were to go here and I were to click on this PDF, then I could download a handout so that you could better share this with your community of our legislative priorities.
Joshua, I just wanted to point out that we dropped in the chat a link to the website page that Joshua's on right now. And also there's a link to the PDF that he just pointed out for the 2025-2026 legislative priorities. I'll drop the endorsed bill PDF in next.
Great. Thank you, Jennifer. And again, I want to emphasize, and I know I've already said this, but this is a lot of information that's being given to you right now. And I know for me that sometimes I need a little bit of time to, sit and process and think about how this information relates to me. So that's why, again, we will be available at any time with our contact information put forward at the end of this presentation and, of course, on our website, and will be shared out.
Said that voluntarily?
Oops. I'm just going to mute someone to make sure that we're staying on. But yeah, so I'm going to move on to our endorsed bills list. And I want to again emphasize we are always happy to have conversations and help, prepare or help you with talking points as you think about meeting with your legislators. Okay, so our endorsed bill list, which are the bills that, we want to throw on your radar and we want to make sure that we're still giving attention to, even if that first list is where we're going to be allocating the most time and energy that we have at the MDDC to make our top priorities. So here we have yes.
We have a question from Iwiji.
Awesome, yes.
Yeah, I have a question. Like, I always wonder, like, these bills that you list or whatever, what if, like, let's say that the building, one of the ones you talked about is the building, whatever.
Mm-hmm.
What makes sure that someone actually followed that? Like, does it have like what's that word? Like if someone don't follow it, always have the a conscious trend or whatever.
Right.
Trends.
A consequence. That makes a lot of sense. Yes.
Yeah, like I was wondering that all these laws that the Fed, how do I say, you guys are like putting, how do you guys like, do you guys like put like where there's the laws and after that, if someone don't follow it, this will happen? Or is it like where hoping that someone actually does follow it? Because like, yeah, like we can make the laws or not make the laws. We can suggest a law. Like how do...
Right. Can we assess the law? So that is a fantastic question. And what I want to make sure that we emphasize is that currently in our step in the process, these are all proposed bills. These are not at the point where they are laws. They are, pieces of legislation where there's information where they have been, looked at and assigned to a joint committee, which is people working in the House and people in the Senate who will then work together to, think through this and to, take their time, hearing the stories of people in the community. And that's why it's so important for us to share out and prepare testimony so that we could talk about why something, exactly as you pointed out, with building access is so important to us. So at this point, these would not be laws. These are bills that have been proposed in our legislation we're thinking about. And then if they were to be passed into laws, then it would be the responsibility of the state with all of our different groups and our powers and the team that we work together to uplift Massachusetts residents, including people with intellectual developmental disabilities, to then make sure that the laws are being followed. Jennifer, do you have anything you want to add?
Yeah, thanks for asking the question, Luigi. So these are all proposed policies. These are ideas for laws. And our legislators, they're looking at this session. We have a 2-year legislative session that just started in January. And each one of these bills will likely go to a committee where lawmakers will read them over and they'll have discussions and they'll invite the public to come and talk about why these bills are important. And then they'll vote. And some pieces of legislation might make their way all the way through the legislative process and even reach the governor's desk and maybe even get signed by the governor. If that happens, then they become law. So for right now, these are bills proposed policies that the legislature is considering, and these particular policies align with or are match up to what the DD community said was really important to them. So that's why we selected these and we want to focus on them. We're going to track them and we're going to share information when these bills go to a hearing. And we're going to share that information out to the DD community. So if it's important to you, your family, or other people you know with disabilities, you can testify, share a story, call your legislator, and let them know how you feel and how, the bill could impact you if it were to become law.
Great. Thank you, Jennifer. Fran, I see you have your hand raised.
Yeah, I just had a question. So one of the, I don't know, I forget what number on the law, but one of the laws is that passed recently is the high school diploma situation. And I've asked people this many times, and not you guys, but in general, does that cover retroactive for people with disabilities that have gotten a certificate attendance that will get retro from it, or like, because the law is not specific and it's the way the wording is written. I don't know. I was wondering if we could talk a little bit about that.
Yeah, that is a great question. That is an example of a piece of legislation that is not currently on our endorsed bills or priority bill list, but is certainly very important. Jennifer, Caitlin, do you happen to have on the top of your head know about that piece?
Well, you know what, Fran? Just because we want to, in the interest of time, end our session on time to respect everybody's time, how about if we connect offline on that? Our information is going to be at the end of the slide deck, and maybe we could, take that up at another time. We can, have the time necessary to get into it. We also have Nora, who would like to speak or ask a question, but she didn't know how to raise her hand. I think she's on her iPhone. So I think she has a question for you, Josh.
Perfect. Yes, Nora, please go ahead.
It might take her a moment to unmute.
Yeah, absolutely. We'll give her a second.
Nora, are you there?
Nora, if at any
There she
point,
is.
Okay,
okay,
I think I'm on. Do you hear
great, I
me?
can hear you.
Yes.
Yeah,
Great. I'm actually walking with my sister who has an intellectual disability. But the prior question from one of the participants was, I interpreted it as, once the law gets passed, which I hope they will, I hope they'll all get passed at some point, how does enforcement go? So, for instance, we go to a healthcare provider and we feel like we're being discriminated against, then what? Or we're working with house staff and are concerned that management is not going as well as it should, or some other complaint. Basically, how do we what's the assurance that they will be enforced?
Do you want me
That
to
was actually my question.
stab at that,
yeah.
Josh?
Okay.
Go ahead,
I,
Jennifer. Yes.
Caitlin, do you want to say something?
Yeah, I can say something quickly to that because that's a big problem, right? When something becomes a law, how do we make sure people follow a law or know about this new law that the rules have changed? And the answer is not that straightforward because sometimes that is tricky to do. We see that with some of our federal laws from the US government, like the Americans with Disabilities Act, right? And that's why sometimes we have lawsuits or people say, hey, you're not following the law. I told you what it was and you didn't listen, and then we have some lawsuits. So what I would do right now, and I have one eye on the clock, so we're happy to have these conversations with people because this is a really important process. I will also shout out that one of our partner agencies, the Disability Law Center, has a lot of great resources and experts who can talk to you about how do we make sure people are following the law and how do we use litigation or how do we sue people or challenge them to make sure that they're following the law. So Luigi and Nora, thank you for raising that. And I think
I think
that's a
actually
big
Barbara's on the phone. I think Barbara,
That's fantastic. So, yeah, Barbara is the leader of one of our partner agencies at the Disability Law Center, and they are experts on using the law to try and help our advocacy. So that's how I will answer your question right now. I'm really happy for us to have a bigger conversation. I also want to ask Josh and Jennifer, because of time, I'm looking that we've got 5 minutes left. Do we want to continue going through our endorsed priority list? Do we want to share that resource with people? We've got 2 slides left at the end after this.
Yeah, Caitlin, I think we should go back to you, and Jennifer, I will drop the endorsed bill list attachment in the chat for people to access. And again, please feel free to reach out to us with any of those good questions are being asked. So I'll stop sharing and give it back to you, Caitlin.
Okay, great. Let me try and I'll reshare my screen.
While she's resharing her screen, Nora, it was such a good question that you asked, and it really does depend on the situation at hand. If there's something going on at a day program, there might be a specific process that you would follow. Like if you received a notification from DDS, maybe a denial or something around your funding, there should be information about how to appeal that. If you're at a hospital, you're not feeling like you were treated the way that the law says you should be treated, then maybe the Disability Law Center could also be a great resource for you. So it really does, depend on the situation at hand in order to know how you would appeal or how you would submit a complaint, whether it's in the education system or the developmental service system. So it depends on the situation.
Oh, and Barbara has dropped an email that you can use to reach out to them. So thank you so much, Barbara, for that. Okay, I'm going to wrap us up with what's next. So we've got this information. We learned about things that were important to us. We learned about some bills that are being proposed that we're going to focus on that we think can help the developmental disability community in these areas. So now what? So number one is some community outreach. I am so blown away and so appreciative of all the good questions and comments that people have shared during this presentation. And we want to do more of that. So we want to work with you. If you have questions about these bills, about these policy topic areas, please reach out to us and let us know how we can work with you or maybe a group or an organization to support your advocacy in these areas. The second thing that we're working on here at the Massachusetts Developmental Disabilities Council is creating a resource library. So across all these policy topic areas, having some information sheets in plain language that talks about these topics and why they're important, and then also some information sheets that talk about these bills and what's included in them and what are all the details in them. So we are working on those as we speak, and we're going to make them available. We'll certainly update our listserv when new resources come out, and you can also check out our website where we'll make sure that we're sharing those resources when we have them. If you have a topic area you want to learn more about and you're wondering if we have resources, again, please reach out to us and we'll be able to connect you and have conversation. And the last one is kind of related to both of these, but so we've got this list of priority legislation, and we want to support community members to provide testimony. So go speak to your representatives and the committees who are in charge of moving these bills along to say how this affects your life. And so we are able to provide you with some support and some education and information to help put together your testimony. So those are kind of 3 things I've got. Jennifer, do you have anything to add, or can I go to our contact slide?
You covered it all. Thanks so much, Caitlin.
All right. So and Jassy, you can wrap us up actually, but this is just our keep in touch slide.
All right. Well, I want to thank everyone for coming tonight. And I also want to thank everyone for having such thoughtful questions and thoughtful comments in the chat. And I'm wondering, do we have time for to stop sharing the slide and we see each other and have a little discussion, or are we pretty close to time? What do you think?
We are at time, but
We're
if
at
folks
time?
want to ask any questions, we'll see what they are, and folks are welcome to hang on if they have questions. And if not, you have to sign off. It is the end of the day, the work day. We will make this recording available for folks as well as the slides that we went through today.
Well, let's stay for a couple of minutes and let's stop sharing your screen so we can see everyone.
All right. I see some people trickling out. Thanks again so
Yeah.
much for joining us. We're going to send out these slides and resources. We might also send out a little survey that asks about who you are and if this webinar was useful to you. And this will help us improve so we can make sure that when we do presentations for the community that they're actually helpful. So yeah, so keep an eye on your emails for that. Did anyone have any questions?
Caitlin, can I mention something?
Yeah, of course, Tatiana.
Since me and Austin's on the DD cancel, so we popped in to help you support you guys. Some of us, if you guys don't know, Wednesday is BCL's Independent Living Day, so some of us is gonna give testimonies to them.
No.
That's awesome. And yeah, Tatiana, way to shout out you and Austin, example of some citizen council members
And
who,
Patricia Jackson, so you're not alone.
yeah, so we've got more DD council here, folks. We've got a whole team of people who want to help people provide testimony, advocate in their communities. We're really here to help you. So thank you, Tatiana, for that shout out. And thank you for coming.
We'll also send a link to a little survey to find out how your experience was today, what some information about something you learned, and how satisfied you were with the information we had to share.
All right. If folks do not have any other questions, I think that we can declare that this webinar is over, and we look forward to keeping in touch with people.